Chapter 16, calculation of medications used intravenously. We have quite a few keywords here. Notice I've kind of highlighted some of the conversion factors. 1 hour equals 16 minutes. 1 liter equals 1,000 milliliters. And we'll cover the rest in the chapter. We'll skip past the pretest unless you're feeling confident. So IV medications require precise measurements because the medication immediately enters the bloodstream with 100% bioavailability. Hospital pharmacy technicians usually prepare and deliver a 24-hour supply of intravenous solutions to nursing stations. Large volume parenterals contain more than 250 ml solution, where small contain 250 ml or less. LVPs for continuous infusion with or without added medications may drip slowly into a vein either by gravity or through a pump. An IV infusion set includes tubing for carrying the fluid from the container to the patient. Medications may be added to small volumes of fluids for administration on an intermittent basis, either through an injection port in the tubing or a secondary line called an IV piggyback. Most IV piggybacks are small volume parenterals that are delivered over 30 to 60 minutes. So here's what that IV tubing looks like. And here's the piggyback. Parenteral nutrition is delivery of a patient's nutritional needs via IV infusion. It is generally prescribed when a patient is unable to ingest and process nutrients orally. It can be used to maintain nutritional needs on a short or long-term basis. A rate is a value per unit of time. An infusion or flow rate refers to the amount of IV fluid entering the body over a specific amount of time. It can be expressed in terms of milliliter per minute, milliliter per hour, or an amount of drug per minute or hour or drops per minute. The reason for therapy dictates the type of fluid and rate of infusion ordered. Fluids given to keep a vein open are given slowly, whereas replacement fluids are given at a rate that will provide the necessary fluids while preventing an overload on the vascular system. The pharmacy technician must be able to calculate how long a particular volume of fluid will run in order to calculate how much longer a currently hanging intravenous solution will last and when the next IV is due. This ultimately will determine the amount of medication to be prepared for a 24-hour period. So calculations with IV infusion rates can be used to determine the following: the amount of medication delivered over a specific period of time, the volume of medication over a specific period of time, the volume of medication needed to last a specific amount of time, the length of time a medication dose will last. So let's go ahead and do example 16.1. Example 16.1, how much fluid will a patient receive in 5 hours at the infusion rate of 125 milliliters per hour? So right now it gives me a conversion factor we're going to use in a proportion. So just like in all proportions, we need to have the same units directly across as we do on the other side. So we're looking for how much fluid. So that's our volume in milliliters, and we want to know at 5 hours. So what we need to do is just do our normal type of math. Going 1x, which is just x, is equal to 125 times 5. So the answer is 625 milliliters. They will receive 625 milliliters in 5 hours. Now, what is the infusion rate in milliliters per hour of 1,000 ml IV to run over 8 hours? So remember, infusion rate is volume over time is the infusion rate. So our volume is 1,000 milliliters and our time is 8 hours. So just do 1,000 divided by 8, which is 125 milliliters per hour. And what is the infusion rate in milliliters per minute of a 1,500 ml IV to run over 12 hours? So this is the same thing as the above, except for they want the time in minutes. So we need to take that 12 hours and use the conversion factor of 1 hour is equal to 60 minutes. So we can do that just like we do our normal conversion type problems and proportions, but just a little trick is you can always just take your hours and multiply it by 60 to get in the minutes. So 12 times 60 gives us 720 minutes. So now I'm just going to go 1,500 ml over 720 minutes. Infusion rates can be in hours or minutes, so that doesn't matter. So now I'm going to do 1,500 divided by 720, which is going to give me 2.08, which we would round down to 2 milliliters per minute. And then how long would a 1,000 ml IV last at 50 ml per hour? So we have the conversion factor we're going to use, which is the infusion rate, and we're going to put 1,000 ml up here, and we're looking for how many hours. So this would be 50x is equal to 1,000 times 1, which is just 1,000. And we want to get x alone. So we're going to divide each side by 50. Crossed off the one side. So I just have x, and then I have 20. So it's going to take 20 hours. Example 16.2. A physician orders heparin 10,000 units per liter for continuous infusion to run at 100 ml per hour for a post-myocardial infarction patient. How many units will be delivered per hour? So this example is going to require two proportions. All right, so for the first proportion that I'm going to do, I am going to use this 100 ml per hour in one side of a proportion. So since I have to do two proportions, the first one I'm going to do because I want to find out how many hours it takes the heparin. So this liter here, we know 1 liter is 1,000 ml. So we want to know how much that 1,000 ml takes. So 100x is equal to 1,000 times 1. We know that's 1,000, so I'm just going to skip that step. We want to get x alone, so I need to divide both sides by 100. So if I divide this side, that crosses off and I just have x. And then I just need to do 1,000 divided by 100. Oops. Which tells me that's going to take 10 hours. Now, in my next problem, I'm looking my last problem answering the question. how many units will be delivered per hour? So X units over 1 hour. So I know I need to have hour here and units here. My units is of course going to be my 10,000 units. And my hours is going to be my 10 hours. So I would do 10x is equal to 10,000 times 1, which is just 10,000. I want to get x alone, so I need to divide both sides by 10. That crosses off. And 10,000 divided by 10 is equal to 1,000. So 1,000 units per hour. Calculations can also be made to determine how much medication a patient has received at a particular point in their therapy in case the IV is discontinued or infiltrates and must be stopped before it is completely finished. All right, so let's do 16.3. Example 16.3, a 1 liter IV of D5W contains 80 milliequivalents of potassium chloride. The IV was discontinued after 650 ml of the fluid infused. How many milliequivalents of KCl did the patient receive? So remember again, our 1 liter is equal to 1,000 milliliters. So we're going to do a proportion. So we want to know how many milliequivalents. So X milliequivalent over this. How many milliequivalents did they receive from the 650 ml they got from the IV? So then on the other side, of course, we need milliequivalents and milliliters. So our milliequivalents are going to be the 80. And our milliliter is going to be that 1,000. And then we're just going to do 1,000 x is equal to 80 times 650. So first we need to take care of that 80 times 650, which is 52,000. And then we have 100x or 1,000x. And we want to get the x alone, so we need to divide each side by 1,000. $52,000 divided by 1,000 is 52 MEQ. That is how much they received in the 650 ml. A drip rate, sometimes called the drop rate, represents the number of drops administered over a specific time via IV infusion. It is a specific type of infusion or flow rate measured in drops per minute. The calculation of drip rate is affected by the size of the tubing used to deliver the medication. A drop factor is found on each tubing package. Various drop factors are available. 10, 15, and 20 are macro drip tubing sets, where 60 drops per ml is considered a micro drip tubing set because the drops are much smaller. The rate of infusion for IV fluids must be calculated to complete the physician's order, which provides the type and amount of fluids and usually a desired infusion rate or infusion time. The proper infusion set must be chosen to supply the fluids as ordered. Therefore, the 4 factors to be considered with administration are as follows: the total amount of fluids to be administered in milliliters, the calibration of the administration infusion set in drops per milliliter, the flow rate of the fluids in drops per minute, and the time for the fluids to infuse in minutes. Calculating flow rates for IV fluids is accomplished mostly using DA. However, example 16.4, a physician orders Pepsid 20 milligrams and a total of 50 milliliters of normal saline to run over 25 minutes. Calculate the drops per minute if the drop factor is 20 drops per ml. All right, so our drop factor problems are going to be using the equation volume over time times drop factor. So our volume is going to be our 50 ml. Our time in these problems should always be minutes, which we have 25 minutes. And our drop factor is 20 drops per ml. So 50 divided by 25 times 20. And that is going to give us 40 drops per minute. Because these 2 milliliter units cross off and I just have drops and minutes left. Example 16.5, a physician orders 3 liters of D5W to run over 24 hours. If the drop factor is 20 drops per ml, what is the drip rate? Okay, so our volume for this problem, we're using that same formula that we did before. So our volume is going to be that 3 liters. So if 1 liter equals 1,000 milliliters, then 3 liters is 3,000 milliliters. And of course, we could do a proportion solving for that, but hopefully sooner or later you can make those kind of connections between the numbers. And then our time is 24 hours, and we know that we have to have minutes. So like I said before, if we just take our minutes, our 60 minutes and multiply by the hours, we can find out the minutes a lot quicker than doing a proportion. So we would do 24 times 60, which is 1,440 minutes. All right, so now we have all our information. We can do our problem. So we have 3,000 milliliter over 1,440 minutes times 20 drops per ml. So 3,000 divided by 1,440 times 20, which gives us 41.6, which we would round up to 42 drops per minute. In some instances, the physician will provide an order for the amount of fluids to be infused in the milliliters per hour without providing the specific infusion time. The problem then becomes a question of how long will it take for each volume of fluid to be infused using the rate ordered by the physician. As the pharmacy technician, you have a responsibility to ensure that fluids are available for the next dose as ordered. Therefore, when the time is not designated but the amount is designated, the necessary calculation may include deciding how long the ordered fluids will take to infuse when the infusion rate and or drop factor is provided. So let's go ahead and do these examples. Example 16.6, a physician orders lactated ringers and 250 ml to be infused at 50 drops per minute with an infusion set of 10 drops per ml. What will be the infusion time in minutes? This problem is going to require two proportions. The first one I'm going to use the 10 drops per ml. And the next one I'm going to use 50 drops per minute. Just to kind of show you. And then, so I know I need to have the same exact units across. And I know ultimately I'm looking for the infusion time in minutes, and that's obviously what I'm going to get from the second proportion. So I'm just going to go ahead and plug in my X there. All right, so for my first problem, I'm using that 10 drops per ml. I have 250 ml. What I need to find out first is how many drops is that 250 ml. So I can plug that into here. So X1X, which is just X, is equal to 10 times 250. So 10 times 250 is 2,500. So that's 2,500 drops, which I'm going to plug in here. And then I can do my problem here. So I have 50x is equal to 1 times 2,500, which is just 2,500. I want to get x alone, so I'm going to divide each side by 50. So 2,500 divided by 50. Oops. Is 50. Why did I do that? So our answer is 50 minutes. Example 16.7, a physician orders 2,500 ml of D5NS to infuse at 30 drops per minute with an infusion set of 10 drops per ml. How many minutes will it take for these fluids to infuse? So again, we're going to do two different proportions. Using both of our, first I'm going to start with my 10 drops per ml. So this is pretty much going to be exactly like the previous problem. And the second one, I'm going to do 30 drops per minute. I'm just going to put in all my units that I know I need to have. The question is asking me how many minutes, so I know that's going to be my X. I'm just going to go ahead and plug that in right away. Up here on top, I need milliliters, so that's going to be my 2,500 milliliters. So what I need to do is find out how many drops that 250 ml or 2,500 ml is, so I can plug that in down here. So 1x is just x is equal to 10 times 2,500. Which is oops, it's too many. Is 25,000 drops. And then I'm just going to plug that in down here. And then I can go ahead and do my math. So 30x is equal to 25,000 times 1, which we know is just 25,000. I want to get x alone. So I'm going to divide each side by 30. It gives me 833.333 repeating, which we would just round down to 833 minutes. Example 16.8, a physician orders amphotericin B 40 milligrams IV piggyback to be administered in D5W 250 ml to be infused at a rate of 20 drops per minute with a drop factor of 60 drops per ml. How many milliliters should be added to the fluids if the amphotericin B is reconstituted to 50 milligrams per 10 ml? All right, so we're going to use this part of this problem here for one part of our proportion. So again, we need our milligrams on top and milliliters on bottom. We're looking for how many milliliters, so I need to plug in my milligrams, which is 40. So 50x is equal to 40 times 10. 40 times 10 is 400. And we want to get x alone, so we need to divide both of them by 50. Which is going to be 8 milliliters. What is the total volume to be infused? The 250 ml that the IV bag already is, and then the 8 ml we added, which is 258 ml. How many minutes will it take the IV to infuse? So for this one, we need to do two proportions as well, using, just like we did in the last two examples, the 60 drops per ml. And also the 20 drops per minute. So we know we're going to do 258 ml. How many drops is that? So 1x is just x is equal to 60 times 258. Which is x is equal to 15,480 drops. Right. Okay. All right, and then down here, I'm going to plug in that 15,480 drops. And my x will be here. So 20x is equal to 15,480 times 1, which is just 15,480. We want to get x alone. So we're going to divide each side by 20. Which means x is equal to 774 minutes. Example 16.9, a physician orders a piggyback of vancomycin 1 gram and 100 ml of D5W. The drop factor is 20 drops per ml, and the infusion rate is 1.5 milliliters per minute. After reconstitution to 500 milligrams per 10 ml, how many milliliters of vancomycin solution must be added to the 100 ml piggyback? So we're going to use the strength, the 500 milligrams. And then on this side, I'm looking for how many milliliters. So that's going to be my X. And then I need milligrams up top. Looking at my problem, I have 1 gram. 1 gram is equal to 1,000 milligrams. So 500x is equal to 1000 times 10. So 1000 times 10 is 10,000. We want to get x alone. So we need to divide both sides by 500. So that crosses off. I just have x. And then 10,000 divided by 500 is 20. So 20 ml of vancomycin solution should be added to the 100 ml piggyback fluid. What is the total volume to be infused? So that is going to be the 100 ml IV bag plus the 20 ml medication we add to it. So 120 ml. How many minutes will it take for the vancomycin to infuse? All right, so we're going to use our infusion rate we have in the problem of 1.5 ml per minute. We want to know how many minutes, so that's going to be my X. And our milliliters is going to be our 120 milliliters that we just found out. So 1.5x is equal to 120 times 1, which is just 120. We want to get x alone. And so 120 divided by 1.5 is 80. So 80 minutes. How many drops per minute would be infused? So remember, our drip rate problems are volume over time. So our volume is our 120 ml. Our time is our 80 minutes. We're going to multiply that by the drop factor, which is 20 drops per milliliter. Now I'm just going to do my math. 120 divided by 80 times 20, which is going to give me 30 drops per minute. Traditional 2-in-1 parental nutrition supplementation includes base solutions of 2 essential macronutrients, dextrose, which is carbohydrates, and amino acids, which is protein, along with electrolytes, vitamins, trace elements, and water. A stable IV lipid emulsion is included in some formulations, resulting in what is called a 3-in-1 formulation, which includes 3 macronutrients, carbohydrates, proteins, and fats. In addition, parental nutrition solutions can contain medications such as regular insulin and others as needed and indicated given the patient's clinical situation. Parenteral nutrition can be administered via either central or peripheral lines, with central lines often placed in the superior vena cava and peripheral lines inserted into the veins of the arm or hand. Peripheral parental nutrition must be lower in strength than total parental nutrition. TPN is administered through larger central lines where the solution is diluted in the bloodstream quickly. Peripheral vessels are smaller, so the solution is not diluted in the bloodstream as quickly. Chronic parental nutrition can even be administered and managed by patients in the ambulatory setting. 2 types of calculations are used to determine the contents of a parental nutrition solution. The first involves determination of the amount of base solution, so dextrose, amino acid, and lipids. The second involves calculations of the amount of additives, such as electrolytes and medications, to be included. When calculating the amount of stock solutions to use, To obtain the appropriate strength of base solution ordered, you should use the dilution equation, SV times SS equals dV times ds. So let's go ahead and do example 16.10. Medication order calls for 1 liter of TPN solution containing 2.125% amino acids and 25% dextrose. In stock are 8.5% amino acids, 50% dextrose, and sterile water for injection. Calculate the volumes of 8.5% amino acids injections and 50% dextrose injection needed to prepare the desired concentration of each ingredient. Then QS with sterile water for injection to 1,000 ml. So what that's saying is the final 1,000 ml solution is to contain 2.125% of amino acids, and the stock solution is 8%. So for this one, we're going to go back to chapter 15 and do one of our dilution problems. So now our desired volume is the 1,000 ml. Our desired strength is 2.125%. Reading from here. And our stock solution is 8.5%. We need to find out what the stock volume amount is. All right, we need to take care of this side where I have 1,000 times 2.125, which is 2,125. Now I want to get SV alone, so I need to get rid of this 8.5. So I'm going to divide each side by 8.5. So 2,125 divided by 8.5 is 250 ml. So we need 250 ml of the 8.5% amino acids. The next part of the problem, the final 1,000 ml solution is to contain 25% dextrose. The stock solution is 50%. So what we're essentially doing is doing the same thing that we did in the previous part. We're doing a SV times SS equals dV times ds. So we can find out the amount of dextrose needed. So you can see here, our stock strength is 50%. Our desired volume is the 1,000 ml, and our percentage of dextrose is 25. So when we work out that problem, SV times 50 equals 25,000. We want to get SV alone, so we divide both sides by 50. We get 500 ml of 50% dextrose is needed. And to calculate the final sterile water for injection needed to bring the solution to a final volume of 1 liter, subtract the volumes calculated above from the final volume desired. So we have our 1,000 milliliters minus our 250 ml from the first part of the problem, and then minus the 500. And we are left with needing 250 ml of sterile water for injection. Example 16.11, an order calls for the following to be added to a standard 1 liter TPN solution that contains 50% dextrose, 10% amino acids, and 20% fat. Calculate the amount of each additive needed. So essentially what we're doing is we're taking the strengths of the medications for each one. So for sodium chloride, the strength of the vial is 50 milliequivalents per 20 ml. So we're going to do this for every single problem. So we're going to have the strength of the vial and then the amount of the product. We're always going to be looking for the ml. So you should know how to solve these by now. I'm just going to help you set them all up. So then for the potassium, it's 40 milliequivalents per 20 ml. And we need 15. The next one is potassium chloride. It comes in 30 MEQ per 15 ml vial. And we are putting in 25. So this is the last one I'm going to write out for you. You need to do this for all of the different ones. Remember that when you're solving for X, you're going to want to, so 50X is equal to 30 times 20. And you should by now know how to do this. We only have one more chapter left of this module. So this should be something that you caught on to by now. If you haven't, then of course you need to get with your instructor so we can get you up to that level. But you're going to do that for each and every product. Remember, for the insulin, it's going to be 1,000 units per 10 ml, which is 100 units per ml also, but you can just take it from here and not get confused. Then you're going to add up all of the additives, so all the amounts you calculated. It should come out to 52.1 ml. And if the TPN is hung at 0800 hours and is to run at 75 milliliters per hour, when will the next bag be due? So they just set up a proportion using the runtime of 75 milliliters per hour. They added up the 1,000 ml IV bag with all of their additives, and they're searching for how many hours that's going to take. Complete the math, and you should get 14 hours. The pharmacy is responsible for providing the medications and fluids to fill physicians' medication orders. In addition, the pharmacy is responsible for ensuring that adequate amount of fluids are provided for the desired length of therapy. Furthermore, you may be asked to calculate the amount of time that a container of fluids will last, the necessary volume of fluids, or the rate of infusion per minute or hour to provide the medication as ordered. Patient safety is ensured when the correct fluids ordered by the physician are calculated for the correct infusion rate. Because of the immediate action of medications administered through an IV route, the pharmacy must take extreme care with these calculations. As the pharmacy technician, you must be sure the correct fluids are chosen along with the correct medications. Rechecking calculations always enhances patient safety.